And in 3, 2, 1. Hi, everyone. Welcome to Sandy K Nutrition, Health and Lifestyle Queen. Today with me, I have Josh Dech. And Josh is an ex-paramedic, a holistic nutritionist, a medical lecturer, and he specializes in digestive diseases. Josh works with clients to uncover the causative factors causing these symptoms to help reverse these disease states. And Josh's specialty is the gut. And today we're going to actually be talking very specifically about irritable bowel disease. And then Josh was just correcting me because there's a few differences, and about constipation, anything relating to these issues of the gut. So, with that, welcome, Josh. Thank you for coming today.
Oh, Sandy, it's a pleasure to be here. I appreciate you having me on.
Yeah, I'm happy to have you on because we just somehow, I forget how we connected through some sort of social media, but like we just kind of connected and started chatting. And you've got your own podcast, and I absolutely loved our conversation. So I'm glad to have you on my show. So
Thank you.
I want you to tell, because you're an ex-paramedic. That's
Mhm.
interesting. So tell me how you got to where you are now.
Well, I like to say it's been a chain of happy accidents. Just one thing leads to another. I loved EMS. I love being a medic. I loved working with trauma and, medical emergencies. But it didn't take long before I realized I was working in sick care. I pick people up for the same stuff. Emergencies in the way of medical traumas, car accidents, those types of things, there's nothing we can do. But the
Yeah.
people who come in with strokes and diabetic issues and heart disease, these things were repeat offenders for the same people over and over, and they never got better. And it wasn't until my early 20s I tried to actually move across the country to find a better job as a paramedic. And while I was looking for that job, I got a job as a personal trainer. And so it's something I've been involved in the fitness world. I've done bodybuilding competitions in the past and all that in my late teens. And so I thought, well, I can do this for a living. And so a woman came to see me, and she was the kind of person I would have picked up in the ambulance. She had 17 pills and a shot of insulin for breakfast. She had 9 pills and insulin for bedtime. So we're talking 26 pills a day. She slept with a CPAP machine because she had sleep apnea, kept waking herself up. She was on the disability list at work. Her blood pressure was through the roof. She had all these different issues. And so we started working with her. I was probably 21, 22 at the time. And she was 57 years old when she came in to see me. By age 59, she was off all but 2 medications, doing nothing but exercise, nutrition, and basic lifestyle wellness. All of her diseases were fully reversed. Her eyesight actually got better. She had to get her prescription reduced because her eyesight improved just by getting her blood sugar re-regulated. And so at age 59, I said, Lynn, how much do you trust me? She goes, oh, I trust you. I said, great, sign this paper. And she did. She just, okay. I said, great. 3 months time, you have your first powerlifting competition. So we got her a singlet, we got her a belt at 59 years old. And Sandy, she broke a world record in the raw powerlifting division. And so this tiny little 5 foot tall, 160-pound woman ended up breaking a record and broke them till she was 62, 63 when she retired. And I realized that the human body has this immense capacity to heal itself. And looking back at paramedics, she's the kind of patient I would have seen in an ambulance. And now she was the kind of client who I like to see today. Somebody who can actually reverse these diseases, not in sick care or just managing diseases, but healthcare. And
Mm.
so I started to pursue that further and further. And I saw people in my practice as a personal trainer who are dealing with depression, with skin issues, psoriasis, asthma, I've seen severe hypertension, like should have had a stroke. I actually assessed a gentleman, took his blood pressure as part of our vital intake, and I sent him home. I said, you need to talk to your doctor because we can't lift today. You'll have a stroke. His blood pressure was like 210 on like 120. I've never seen it that high before. And so anyways, we got him off of drugs and all kinds of stuff. And so the body is so capable. And so I've always been interested in this, started diving in, and I was at a trade show and I heard a woman on stage talking about the gut microbiome. And the things that she started saying, I'll share some of those with you during this episode today. It absolutely blew my mind. And I looked at this and I said, that is what I'm going to do for the rest of my life. Like it was love at first sight. And I got hooked on the gut and the gut biome, its connection to everything. I went back to school, became a nutritionist, and I started meeting people's needs where they were at. And everything, Sandy, everything came back to the gut. And I mean
Hmm.
every disease. Again, asthma, psoriasis, eczema, arthritis, cognitive issues, ADHD, obesity. It all came back to the quality of the gut health. And that's where I specialize today now. And people just came to see me for more and more severe stuff until one day I decided I'm just going to do Crohn's and colitis. That's mostly what I do now in my practice because that's the greatest need in bowel health.
Mm. Yeah, I just did a show not that long ago. I actually just released it but by the time this comes out, it'll be out for a while. And it was with Neurohacker about gut health. And it was
Mm.
more of a general discussion on the gut, why it's important. So maybe just start high level, like why is the gut connected to everything, all of our health, all aspects to our health?
Well, there's a saying that goes, you are what you eat. And I think if we take that one step further, you are what you break down, digest, and absorb. So that's number one. If you do not break down, digest, and absorb adequately, you will not be healthy. Your cells need those nutrients from whatever you're breaking down to absorb and to recreate new tissues, new cells, new everything. And if they're not getting that, they will deplete and they'll actually start robbing nutrients from other locations. There are so many people out there, and this is maybe something people never really thought about, but we've all, I'm sure, at some point dealt with sensitive teeth to hot, to cold, whatever it
Yeah,
might be.
yeah,
A lot of the
absolutely.
time, right? I've dealt with that myself. Well,
Yeah.
here's what was going on with most of these people. Their gut, they have issues in there somewhere. They're not breaking down, digesting, absorbing, or they're nutrient deficient, and their body is actually taking minerals away from their teeth, which wears
Yes.
down and thins the enamel. And so that's number one. We always have to think that your body is constantly trying to grow. If we don't give it the tools to do so, it will find them from somewhere else. And that's going to be bones and joints and other things. So, number two, your body's always looking for that homeostasis as well. That's that self balancing act. If it can't do that, again, it will draw things from other areas. It will draw resources, leaving you depleted. And anytime you are depleted in a function, you create dysfunction. And this is where diseases start to come in. People have osteoporosis. I'm sure there's any women listening who have had babies or had friends who have had babies and actually developed like an osteoporosis or baby brain. What's happening is the baby is actually leaching minerals from mom's bones because that baby in utero takes priority. Or baby brain. Two-thirds of the dry weight of the human brain is what we call DHA, which is what you'll find in omega fatty acids or omega-3 fish oils. If you don't get enough of this DHA, then the baby will take that because it needs to develop its brain. And so mom
Mhm.
gets a little bit of this baby brain fog. And so that's number two. Number three, there's a couple of these ones here. Your gut bacteria are immense. I argue sometimes that they may very well be more important than our DNA. And I say that because number one, we have about 23,000 genes in the entire human genome. We have over 3 million genes residing in our gut bacteria, and they interact with everything. They are 2 to 3% of the entire weight of the human body is just bacteria. It's actually pretty disgusting when you think about it.
That is
It's
gross when you think of
right.
it.
We're just microbes. And these bacteria interact with everything. They help balance hormones. They detoxify. They're responsible for neurotransmitter production, which are the things that help your brain stay healthy, or dopamine, or serotonin. They're in immune responses and healing responses. Your bacteria can even determine how social you feel like being on a given day. It's incredible what they're linked to. They do everything for you. And these slight imbalances have this domino effect and like just unfathomable repercussions. A single dose of antibiotics, for example, it could take you months to recover and you might be off kilter until then. We know 70% of your immune system, your immune cells, are actually made, grown, and matured inside your gut. Up to 90%, like we said, of those neurotransmitters are coming from the gut. So if you have anxiety, depression, mental health disorders of any
Oh,
kind,
yeah. Yeah,
bipolar,
yeah.
it's back to the gut.
Yeah.
And so there's a great paper by Dr. Alessio Fasano, and it says it's called All Diseases Begin in the Leaky Gut. And then for the last one, I'll throw on here because we can keep going, but I'll throw one more. Your bloodstream and lymphatic system are one cell away from your gut to everything inside of your gut. And so if you have leaks, you have toxins imbalances, they leak through the gut, get to your blood, get to your lymphatics. They circulate around these highways, getting everywhere. So any toxins, you can get them in your joints. Now you have arthritis, you get them in your lungs. Now you have asthma. And it's just this ever connected piece of tissue. It's like your gut may as well be your blood. It's really quite amazing.
Mhm. So, I think a lot of people suffer from I look at it as two major issues. And I know that there are nuances, and you explain that to me, and you will explain it to the audience. But either slow transit time,
Mm,
constipation, or fast transit time. And I've heard a number of experts in this area talk about actual personality traits as it relates to that slow transit time and fast transit time. And so today we're going to talk more about those issues because it's embarrassing. Like, if somebody's always got to run to the bathroom and you're in a public place, like people need to understand that there are things that we can do to help this. So maybe let's get into what these issues are called because there are specific
mhm.
terms. And often when we go see our general physician, they'll say, there's not a lot you can do,
Yeah,
right? So maybe let's get into that, Josh.
absolutely. So there's this really odd phenomenon where physicians will often call somebody has diarrhea, lots of diarrhea, very loose stool. Like you said, 10, 15 times a day. They're constantly running to the bathroom. I've heard physicians call this functional diarrhea or functional constipation. Now,
Oh, I haven't heard that one.
oh, it's
Wow.
asinine. No pun
Wow.
intended here, but let's look at the word function. Function means healthy, optimal, right? It's functioning well in this context. Now, if we look at dysfunction, it means it's not functioning well. So if you
Right.
have constipation or diarrhea, you have dysfunctions. How can we call it a functional diarrhea or functional const? It's just the way you are. It doesn't work that way.
No.
And so you talk about different things. We know loose stool, diarrhea. We know slow bowels, more of a constipation. Everything we talk about in medicine sits on a spectrum, right? So if we look at somebody who's very, very slow, and it's shocking actually, the slowest bowels I've seen. I had saw somebody recently in the last couple of months here alone, Sandy. Years back, I saw a woman. She was having a bowel movement every 2 weeks, one
Oh
bowel
my
movement
God.
every 2 weeks. It was medically induced with a whole bottle of magnesium citrate. I thought that was bad. I met somebody else who had one every 4 weeks, and I've
Wow.
never seen that in my entire career. But the risk for that obviously is getting this impaction, having to get disimpacted, or having ruptures, or worse yet, what's called fecal vomiting. If it can't go down, things can come up. And
Oh
it's
my God.
really, oh, it's horrible. It's a horrible condition. And so what ends up happening is these bowels aren't working properly, they can slow down. But on the same spectrum, they can speed up. And so what we have to understand is whether it's slowed bowels or rapid bowels, right? People at risk for perforations or surgery versus those who are running to the bathroom. I've seen 50 times a day in my practice with ulcerative colitis. It's all a spectrum of inflammation. It's just which way you lean. So we look at
Okay.
genetics or personality traits, right? We can look at that for sure. And there's some really interesting connections there. But if we simplify it down even further, your body will express inflammation in the ways it's going to express inflammation. For example, if my gut, I have a bunch of bacterial imbalances and issues. My family, I express issues in my gut. If I'm stressed, it goes to my gut. That's genetic for me. Somebody else might get arthritis when they're really stressed. Now, they probably have gut issues, but it's being expressed through their joints.
Right.
Right? So it's all about your genetic expression. That's the weak link. That's what snaps first. And so my first snap is my gut. I was at a point when my gut was so bad. I was 15 times a day in the bathroom, 10-minute transit time. I'd eat and out it went. I lost 25 pounds. I could hardly move, fatigued, mood swings. It was a disaster. And so we have to look at this as a spectrum. Am I inflamed? Yes. How severely? Well, the level of constipation or diarrhea can indicate the level of inflammation to a degree. But it's not to say you're more or less inflamed if you're fast or slow in the bowels, right? They're both spectrums of inflammation. It's how you respond. And then we go to the doctor and we look at diagnoses. So a doctor might diagnose irritable bowel syndrome, which technically isn't a diagnosis. It's considered a diagnosis of exclusion, which means we don't really know what's going on. So we'll just kind of give it this syndrome quote, and it sort of covers the umbrella of here's the symptoms we expect. And again, you can
Okay.
be slow or fast bowels. But then if we take that spectrum of severity, really, really bad, right? And I look at this, we'll use the analogy going for a walk. I'm sure you've all gone for a walk and forgot socks at one point, and the heel on your shoe starts to rub, and it
Yeah.
gets red, and it blisters, and it bleeds. And that bleeding is that severity spectrum. So somebody comes in with some redness and irritation on their heel, that's IBS. When you're bleeding, that's IBD. That's inflammatory bowel disease, which is your Crohn's and ulcerative colitis or colitis. And now these two diseases, they're very, very severe. But medicine has spent a very long time, minimum 30, if not 40 years, really conclusively looking at IBS or irritable bowel syndrome and IBD, which is your Crohn's colitis, and trying to separate them and say, hey, these are very different. Here's how. But if you put these on a Venn diagram, they're almost identical. In fact, they'll say, well, the only real difference is severity and pain. And with IBS, we don't typically see blood. But there's an asterisk in there that'll go, well, sometimes we see bleeding. And so they really are the same thing. It's just symptomatically. Now, the challenge is that ulcerative colitis and Crohn's disease are classified unquestionably as being autoimmune. And so
Yeah.
whether you're 5 years old or 50 years old, you go to your doctor and they do their diagnostic criteria and they look at you and go, yeah, here's your diagnosis. They call it autoimmune. But here's the thing. This is what kills me about Western medicine. And this is why it is so backwards and so wrong. And I will tell you right now, if you're listening to this and you have IBD, Crohn's or colitis, there is a better way and your doctor's probably wrong. Now, hear me out. People get very upset when I say this, but imagine you went to the hospital, Sandy, right? You had a thorn in your hand and it's been in there for months and it's getting worse and worse every day. And now it's swollen and it's bleeding and it's infected and your whole hand hurts and you can't even move it. You go to the doctor. What would you expect them to do, Sandy?
Take the thorn out.
Take the thorn out, right?
Yeah.
We expect them to take it out. But
Yeah.
imagine your doctor instead gave you numbing cream for the pain and said, here you go, just take this, that'll make it better. You'd be livid. It wouldn't
Yes.
make any sense. And so nobody's asking, what is the thorn in my gut? My hand is inflamed because the thorn is in there and my body is bringing blood flow. It's sensitizing the nerve so I don't use it so much. And there happen to be added pressure from the dilated blood vessels, but it's bringing white blood cells. It's bringing these cytokines. It's bringing these leukocytes, these immune cells, which are trying to heal and repair you. If they're there too long, they wear and tear like the heel on the shoe, right? They create more tissue damage. And so no doctor's looking for the thorn. And so to have somebody who's perfectly healthy, for example, 5-year-old boy comes in, he's healthy. Within 2 weeks, boom, he's got inflammatory bowel disease. He's now got bleeding. He's losing weight. He's pale and gray. Doctor goes, yeah, it's autoimmune. They give him numbing cream for the pain in the form of autoimmune drugs or immunosuppressive drugs, Remicade,
Yes.
Stelara, Entyvio, budesonide, corticosteroids, right? They give them this instead. But we're not asking, what is your body reacting to? Your immune system, like autoimmune diseases, don't fall out of the sky and drop on our heads. Something has to start this process.
Mhm.
So the question we have to ask is, what is the thorn? Why are you inflamed? And what is your body trying to heal you from? Once we understand and ask that question, we can actually understand these diseases aren't random and you're not stuck with them for life. There's actually a thing in there we have to get rid of. Give your body the tools, and it will begin healing itself. That was my rant. Thank you for coming to my TED
Mm.
Talk.
That would make a really good TikTok, actually. It would. They like long form these days. Um, anyway, so I've never heard it described that way. That's fascinating, the way that you just described that. I love it. But now that we know the difference, what are the symptoms?
Mm.
Because you can have constipation with IBS, right?
And IBD. That's right.
So explain why. I don't get it. Like, usually you think with IBD or IBS, you're always in the bathroom going too often.
Mhm.
So why does that happen?
Well, we have to look at two spectrums again, right? There's two ways of expressing inflammation through constipation or through diarrhea. And so if you're having these loose stools, that's just the way your body's doing it. Some people just get very, very backed up. I'd say in my practice, it's maybe 20% who have slow bowels when they're inflamed. Probably
Yeah.
80% have very rapid bowels with a lot of blood and mucus. But if we look at the difference in criteria, right? IBS and IBD. IBS is a syndrome. You're assessed kind of verbally, symptomatically. IBD, they go in, they do colonoscopies to visualize the level of inflammation. They'll go in and they'll do biopsies. They'll do what's called a calprotectin test. Now, we know there are 5 different types of white blood cells. In one of them, these neutrophils produce this calprotectin as a byproduct. And so what they look at is they say, okay, well, your calprotectin level is above, say, 150 or above 300. Mixed with these other criteria and symptoms, okay, we diagnose you with this inflammatory bowel disease. Therefore, it's autoimmune. But that's again the challenge. We go, you've been diagnosed, therefore. Well, what if you're on the spectrum, right? If 1 to 10 is our spectrum to autoimmunity and you're a 7, your immune system's reacting. Your calprotectin is up. That's really a big differentiator between that and IBS or IBD. And IBS is markers like calprotectin, actual visualization through CT enterography or colonoscopies to check for ulceration. That's how they differentiate the two. But what if you're not actually autoimmune? What if you are severe enough where you're kind of on this gray scale between IBS and IBD? Either way, your doctor calls it autoimmune. And maybe it's not so severe right now. I see this all the time. People coming in, their gut is okay. They're having some issues. And then after a few months or a few years, it starts to get worse. Their bowels get looser. They have more pain and more food intolerances. As time goes on, they develop other conditions where, they're not able to digest fats very well. They're more anxious now. They have skin issues, psoriasis or arthritis, whatever it is. And then it progresses even further. And now they're dealing with more bowel issues where they're having 30 bowel movements a day. And then one day they get blood and they go, oh shit, this is bad. Now they go to their doctor and now they get a diagnosis. Well, now you're at a 7 and now you fit the criteria. But what if you caught it early enough at a 2 when you were bloated and having 10 bowel movements a day before you got the blood, before it had that wear and tear progression? Then you wouldn't have been diagnosed with IBD. You would have been diagnosed with IBS. Had it been addressed early on, it would have been very easy to fix most of the time. But now that it's progressed, we have more damage control to do, right? And so I see it diagnosed in two ways, where it's either a rapid onset or a slow onset, like we talked about over years. And it's really challenging because Western medicine is very backwards. It really doesn't make any sense to me when we look at it plainly.
Also, I do want to add too is that just because something shows once, the only reason I'm going to say this is because I've actually had the experience when I had thyroid cancer. At the same
Mhm.
time, I was having a multitude of issues. So I had a lot of inflammation going on in my body. It's kind of a long story. So I'm not going to get into that here. But what I will say is one of the scopes that I had, I was diagnosed, and if you guys can't see me with this, but I was diagnosed, I'm doing a quote unquote, with Barrett's esophagus.
Mm-hmm.
And then a year later, I was told the inflammation is gone. It just presented in such a way. I had a lot of inflammation going on. So, what I'm saying is that I like how you said that with the different ways that they actually measure inflammation, or they say once you get to this, then you will be diagnosed with this. So,
Mm-hmm.
I think that's important to note. And I do want to also say, um, I'm just big on this, Josh. A lot of times people become their diagnosis
Mm-hmm.
instead of, and I know that I don't know how much you're into the whole spiritual aspect and the connection there, but when you become your diagnosis, it's very, very hard to heal from whatever it is that you want to heal from.
Mm-hmm.
So, I think seeing somebody like yourself and seeking help is the first step. So, anyway, I just wanted to kind of pause there and just say, I can empathize with people who get these scary diagnoses. And it doesn't mean that you have to become that. So, we know the signs of IBD would be more when it's just more severe. That's what you're saying on that spectrum of Crohn's or colitis, when there's blood, bleeding,
Mm-hmm.
right? Is
Well,
that
this,
kind of,
this is a great tie into what you mentioned about identifying with this disease of any
yeah,
kind. And I
yeah,
see people all the time, colitis warrior, and my
yeah,
tummy hurts,
yeah.
but I'm really brave about it. And they're
Yeah,
really nice because it's part of a community. But if we identify with it, we stop looking for solutions. And
thank you.
oftentimes we do look. I've been attacked for saying what I say. I've been harassed. I've been threatened in my inboxes for
Mm,
raising the point that there's another way and a better way. And we're proving it all the time. I've met with some of the most famous doctors on planet Earth because of this.
yeah.
And it's just really interesting how people can react. But let's talk about that identification. I think a lot of that comes down to the fact that Western medicine, I will give them kudos, right? Credit is given where credit is due. They are
Yes.
phenomenal at emergency medicine and surgeries, some of the
Yep.
best in the world, remarkable emergency interventions. However, you give me a hammer for long enough, eventually everything looks like a nail. And so, what Western medicine has done is they take every disease process, even acute or even chronic rather, and treat it as acute. And so somebody who's got disease inflammation for 10 years, they treat it as if it's a one-time infection. Throw some antibiotics, throw some anti-inflammatories, suppress
Hmm.
it, and maybe it'll go away. But they're not going away because the thorn is still in the hand. And so when doctors treat these diagnoses like they're permanent, then we identify this as a permanent lifestyle shift. So I have to, in order to accept it socially, psychologically, mentally, emotionally, I have to now bond and become partnered with this disease. And that is a surefire way to guarantee you're stuck with it. But you don't
Hmm.
have to be. You can choose another option. And the choice is scary because you're not going to have the support from your doctor, but you have to take your health into your own hands, right? Realistically speaking, inflammatory bowel disease is worth nearly $1 trillion a year. It's like 800, I think it's, or is it maybe 800 million? Sorry, nearly $1 billion a year minimum in itself. And a colon removal surgery is like $250,000, like $230,000 to remove a colon. Whereas for a couple $100 a month, you can join some of their programs that will get you reversed in, 4 months. So we have those options, but doctors, unfortunately, and I'm sure listeners who have been there, they've gone to the doctor with a problem. If you do not fit the diagnostic box criteria, right? Here's my symptoms. Here's what's going on. They go, well, we don't really know, but here's some antidepressants. Maybe that will help. Or
Yeah.
here's some antacids. Maybe that will help. And so we end up putting ourselves running in circles, trying to find answers, just being given drugs. And there's no preventative measures taken. They actually will leave it and suppress it until it's bad enough to fit their box of diagnostic criteria. Then you get a diagnosis. Then they give you drug intervention, which is numbing cream for the pain. They're not taking out the thorn. Had they taken that thorn out years ago, you wouldn't have this problem now. And so it's just a really backwards way of looking at things. And if we can understand, like Western medicine will look at you and go, okay, here are your symptoms. Therefore, here's your diagnosis. Therefore, here's the drugs we give one, two, and three. If you do not fix those criteria, they do not really intervene. Sometimes, if at all, they'll send you on your way until it's fully broken. So it's all reactive, never preventative. Whereas functional medicine, right, used to go to your doctor saying, here are my symptoms, blah, blah, blah. Here's what's going on. Here's what medications work. Here's what's not. They can try a new medication. Functional medicine will look at you and go, okay, here are your current symptoms. I don't care what drugs you're on. I don't even care most of the time what's working and what's not. What I want to know is take me back to the first time you started to have some kind of dysfunction because we want to figure out where you got the thorn, how it entered your hand in the first place, how we can look to prevent those from re-entering, and then again, of course, how we can get it out. Once we know what kind of thorn it is, we know where and how to look for it. And then we just reverse engineer the breakdown process. But once you understand this stuff, Sandy, I've read people's mail. I use that as a figure of speech to say somebody will come in and sit down with me and say, hey, here's the symptoms I'm having. I go, okay, when did this start? I'll get 2 or 3 pieces of information and I can read with 80, 90% accuracy, sometimes 100. It's actually a little creepy even for me, accuracy to look at them and say, okay, my prediction is you had symptom A. You started with a little bit of bloat. Your doctor gave you antacids. After the antacids, you started to develop more belly bloat and food sensitivities. After that happened, you got joint pain. Like, yeah, okay, great. After the joint pain, what came first? Was it skin issues or anxiety? Oh, it was the anxiety. Okay, great. When did the skin issues come in? 3 years later. Great. How are your teeth now? Oh, yeah, my teeth are really sensitive. Prone to cavities? Yep. You bite your tongue? Yep. All these little things add up because these are functional symptoms we assess in a systemic whole of dysfunction. It's no different than taking a car to a mechanic. You tell them what's going on, and they can pick out 10 other things that are probably connected to it. Because when you understand the mechanics in the breakdown, all of this just falls into place. And these diseases suddenly go from a lifetime commitment of being on drugs to this fully reversible thing that you actually have hope for.
Hmm. So what are some of the more the root causes of this whole spectrum? Let's say the whole spectrum
It is a
of
spectrum.
it is. Yeah, let's look at some of the root causes of it.
Sure.
Mention them in that little, like what you just said, like antacids, uh, proton pump inhibitors.
Yep.
There's a multitude of causative factors there, but let's get into the main ones. How does this, because you also mentioned genetics. You know,
Yes.
it's interesting because I think it's difficult to pinpoint, but you kind of see that, if you have a family member who's more prone to run to the bathroom every time they have a fatty meal, and then they have issues with their gallbladder and their gallbladder was removed, and then you'll see it again in a family member, right? So there's got to be some sort of a genetic component, but something needs to switch
Mm,
that gene on, right?
totally. So yeah, genetics we say will load the gun, but lifestyle pulls the trigger. Something has to pull it, whether it's a trauma, whether it's food or drugs or whatever it is.
Stress.
Stress. Yeah. So there are four main pillars that we're going to say here to diagnosing, like so we'll say digging into the bottom of these autoimmune diseases. So the first one always is food. That's a gimme. I have people who change their diet and their IBD goes away entirely because they're not eating well. They're eating a lot of fast food or fine foods, nutrient devoid foods,
Hmm.
right? So that's number one, which will tie back into other pillars. So we have food is a big one. Second is going to be chemical or toxin exposure. And so we can look at chemicals and like the paint on your walls and the, what's in your deodorant and shampoos and really get to the nitty gritty. And I will with people who have that genetic autoimmune disease issues, but we're talking for people who say don't, right? Let's put this on a spectrum. The very inner circle, the very core of this thing is going to be diet and quality of the foods, chemical and toxin exposure. So that could be your pesticides, herbicides, fungicides, whatever's on the food, smoking. But a big one I see is things like mold, mycotoxins. 40% of homes in the US have a mold problem. 80% of buildings, it's called sick building syndrome. Actually, Jordan Peterson recently did a podcast episode on this, talking about all the toxins everywhere and how it's connected to these diseases. And so, sick building syndrome, if you ever heard of this, is where many people in one building or an apartment or wherever they are all tend to have similar issues. And that's because of these toxins. So, number one is food. Number two is chemical and toxin exposure. Number three is microbial imbalance. So, that's largely your gut. Now, we often hear microbiome and think about the gut. We have microbiomes everywhere, right? Oral cavity, you have your own oral microbiome. You have a gut microbiome. Your small intestine, your stomach, your large intestine are actually different on your skin, vaginally, rectally, your scalp. They all have these neighborhoods, these microbiomes, these communities that communicate together, which is part of why the gut can disrupt the skin so much because they communicate. And so those microbial imbalances are causing problems. They create leaks in the gut and they travel around the superhighways, your blood and lymphatic and other things. And the last main one is going to be vitamin mineral deficiencies, which ties into food. So food quality, we have chemical or toxin exposure. We have microbial or bacterial imbalances, and we have vitamin mineral deficiencies. That's your inner circle, the core stuff. Outside of that, we're going to start seeing other problems like you mentioned, stress. We have lifestyle, where you live, your predispositions and moods. Are you a type A, type B personality? Because that will influence how often you're in a fight or flight state versus a rest and digest state, for example. How we eat. We always talk about what to eat. We understand basics of nutrition, but how do we eat? Are we sitting down, slowing down, taking breaths and chewing, or are we swallowing an entire burger or a piece of broccoli like a pelican and just getting it into our gullet to move without actually chewing? Because that chewing process stimulates digestion and digestive enzymes and stomach acid and motility. Even the touching and cooking of your own food stimulates digestion. So we have our inner circle of food, chemicals, toxins, microbes, and vitamins, minerals. The outside is kind of everything else. Those are the things that can contribute to and make those core four things much, much worse.
I mean, you were just talking about, wolfing down your food. I did that right before I recorded with you. So, I
How's
mean,
your belly feel?
it's fine. It's fine. 80-20 people, 80-20.
80.
I rarely do it. I
I
rarely do it.
respect that.
So, that's my motto. Everything in balance. Okay. So now that we know why, we know the signs, we know the symptoms,
Mhm.
right? We kind of went through that.
Yeah.
You either go to the bathroom too much, not enough blood. There's a spectrum. Um, so, and we also talked a little bit about the diagnosis in Western medicine.
Mhm.
Now, and you also mentioned how you can kind of see where it developed. So, the biggest thing is you'll get people who will say, I don't want to cut everything out of my diet. And I think, here's where that 80-20 rule comes into play. And maybe at the start, you have to be a little bit more strict. and you have to follow, let's say, follow the rules at the beginning. And then later on, you could kind of, once you heal, calm that fire. It's like putting out that fire, right?
Mhm.
Is that how you work, Josh? How do you work then? Like, what do you do then?
Well, first thing is exactly what we talked about. Let's look for the thorn or thorns.
Yeah.
Sometimes it's death by 1,000 cuts. Sometimes it's multiple things causing the problem. So we have to first figure out what the insult is and what the repeat insults are. And number two, yes, diet is huge. And so I get people all the time, well, I don't want to cut this out. And I don't want to cut out gluten. I've had people come to me with bowel disease trying to convince me that Taco Bell sits fine in their gut, and because they don't have symptoms, they can eat it. And I won't work with these people. I'm like, I can't help you then because you're so convinced you already know. If you're here to work with me, you're investing in this program, you're going to spend 16 weeks with me here. Let's do this thing properly. And so the analogy I use is having a busted up gut is kind of like having a broken leg. Right? Imagine you broke your leg in 6 places. There's bone, there's pins and needles and screws, and you got a cast on. Most people are trying to get up and start jumping on a trampoline already. Can I have the gluten? Can I have the Taco Bell? Can I go out with friends once a week? The answer is no. You got to give it time to heal. We
Yeah.
can pressure test over time, certainly, but we need to have enough time to heal. You can't jump on the trampoline, and everybody
Yes.
wants to do that right
Yes.
away.
Yes.
Right. And so there are things that I will remove. We know conclusively. And there are some people who will say, well, they'll argue and no, gluten's fine for me. Everybody with autoimmune disease needs to avoid gluten,
Yeah, I've
unquestionably.
said that. I've
Right.
said that. But okay, let me ask you this.
Mhm.
Do you eat gluten?
No,
Never.
never. No, I
Okay.
avoid it entirely. And a big reason why I do have a little bit, I've done, stool sampling for myself before, and I do have a little bit of reaction to gluten on my gluten markers. But
Okay.
for the next 3 days, if I were to scarf down a pizza, for
Yeah.
example, I'm also lactose intolerant. These things create leaks in my gut. I'm actually battling a candida issue right now. Long story short, it came from a sinus infection I had to get surgery on in the works. But I've got this issue now. So I've got permeation or leaks in my gut. If I have gluten, gluten creates leaky gut for everyone. And I can explain why. It's kind of cool how it does it. But it creates leaks in the gut. On top of other inflammatory markers, my brain does not work for 4 days. I'm slow. I can't think. I can't conceptualize. I'm not as sharp. I'm not as fast with answers. Working with even clients, it's a disservice to them if I'm eating gluten because my brain can't take their information and piece things together as well as it should if it's inhibited because your gut and your brain, they're kind of the same thing. They call it the second brain for a reason. It's actually made from the same tissue in utero. And
Yeah.
so we know there's a neural connection between the gut and the brain. It's a cool thing to dive into. I do have a podcast episode on that, but it's a disservice. And autoimmunity and gluten do not mix
Yeah.
across the board. We
Yeah.
know
Yeah.
this.
Yeah.
And so it has to be avoided.
Yes. And then you mentioned dairy too.
Yes.
Dairy, because I usually say, because I don't often work with clients anymore, only on special occasions. But I had a client who had an autoimmune disease, and dairy and gluten they had to be gone.
They're the two biggest triggers for
Yeah.
autoimmunity is dairy and gluten, next to, of course, medications and stress factors and things like that. But dairy and gluten are the first things that I cut. Dairy, gluten, sugar, alcohol, processed foods. And the challenge is, especially I'm in Canada and have clients all over the world. Most of my clients are in the United States. And if we look at what's called the SAD diet, ironically enough, the standard American diet, up to
Hmm.
80% of it is just processed. Yes, there's chickens and meats and other things, but people aren't eating these real foods anymore. We're eating this processed stuff. And so when 80% of your diet is artificial and refined, and I say, hey, cut that stuff out, I commonly get the question, well, what am I supposed to eat then?
Mm.
It's kind of like we're caged animals and we're being let out into the wild for the first time to fend for ourselves, and we don't know how to find food. It's actually really bizarre when we look at how it all works. And so we're not eating foods. We have all these modern diseases. Well, these foods have only been around 80 years, some of them, right? Certain seed oils and refined oils, and even the process of manufacturing like burgers on an assembly line, like Ray Kroc and McDonald's. I think that was in like the 30s or 40s or something, or maybe 50s. I don't know. But that's all relatively new. And since 1990, and here's another irony point for you, doctors will say IBD, Crohn's and colitis, is autoimmune. There's no known cause. Or sorry, it's idiopathic. There's no known cause. It's autoimmune. There's nothing we can do, and it's genetic. Well, explain to me this. If it's genetic, why is North America, it's 5% of the global population, Why do they have 50% of the world's cases of inflammatory bowel disease?
Right. Food
Right?
source. Food source.
Can't possibly be genetic. But here's what also blow your mind, Sandy. In 1990, there was about 1.5, as per CDC, about 1.5, maybe 3 million cases around the world actively being seen and treated by a doctor. Today, it's north of 7 million. So how can it be unknown? And if it is, you better figure it out pretty fast. And so we've 3 to 5x our disease cases in 30 years, and we're saying it's genetic and unknown. Meanwhile, up to 72% of all of Americans complain of having gut issues once a week. These are not
Yes.
normal. It just shouldn't be happening. And we're degrading and killing ourselves slowly. And we also know 93% of the leading causes of death, as per the CDC, liver disease, heart disease, kidney disease, strokes, Alzheimer's, Parkinson's, these are directly connected to the gut, the chronic inflammatory diseases. So that means 93% of deaths are largely preventable.
And, I always say this, because I have two kids that love to eat fast food. And, there's only so much I can do because they're not under my roof anymore. They're not little kids anymore. And I'm always like, and they're like, well, what about when you were young? I'm like, but you can't compare
Mm.
the fast food that I ate to the fast food and I know that, there was the invention of what you were saying, like burgers. I don't know.
Assembly
I don't even,
lines and canola
yeah,
oil
yeah,
and all that
yeah.
shit, sure.
But still, the fact is that a McDonald's burger in 1985, when I was 15 years old,
Mm.
was not the same as a McDonald's burger now. It relates to the quality, it relates to factory farming, it relates to all the pesticides, the
Mm-hmm.
herbicides, it relates to glyphosate on our crops. It relates to so many different things that are present now that weren't really present, when I was born, or not as much, let's just say, not as much.
Yeah, I agree. Absolutely. And even the beef quality, now you'll get one single McDonald's burger patty. You get what, 1,000+ different DNA from different cows from all over the place. Most are actually imported. They say US beef, but when the beef gets imported from wherever it gets imported from, as long as they quote add value to it by grinding it or packaging it or doing whatever they do, they can then say it's like US beef. And so there's all kinds of loopholes. You don't even know where it's coming from. You don't know the
No,
quality or the expectations of the food or the regulations of the government to do quality control. And then even French fries. It wasn't until like mid late 90s McDonald's started doing their stuff in canola and vegetable oil rather than beef tallow. That's why they taste so different. And so instead of real fats, you're getting an oil that's actually better off in your car for your engine than in your body. And so all this stuff is just, it's been so bastardized and it's no longer food. I like
it's,
to
yeah,
say it's food-like substances. That's all it is.
yeah. And, like my kids love to just tease me, Josh. So they'll be like, but mom, it says vegetable oil. Isn't that good for you? It's made out of vegetables. And I'm like, oh my God,
Yeah. God love you.
stop,
You are so
stop.
precious. Yeah.
You are so precious. Yes. Okay. So food is a big one.
Mhm.
And if you're not, and Josh, I say this all the time to people who are unwell. So you see a lot of people who will be like on this medication and that medication and all these different medications. But the one thing they're not looking at is what they're eating and also how they're eating. And I'm going to tell you right now, if you're not looking at that, you're missing the mark.
Mhm.
You're never going to be able to get well unless you look at those two factors, right?
Yeah, we're eating fast food like a pelican. That's what it is. It's one gulp down the hatch, stick
Yes.
5 kids in the car, drop them off at soccer, don't chew, just go or go, go, go. We're not sitting and breathing and we're in this fight flight, which adds to the inflammation on top of the food because it's convenient. Oftentimes, you're better off just not eating. And so we do that, and then we combine it with stress, combine it with lifestyle issues, combine it with toxins, combine it with mold exposure, combine it with whatever. And it'll get people who will come in. I'm working with a family. I just met with a family recently. Their daughter broke her arm. And then a week later, she was diagnosed with ulcerative colitis. And they're trying to connect the dots between the arm and the colitis. And I said, okay, that's a stressful event, sure. But
Mm-hmm.
a stressful event won't snap a gut like that. There has to be a weak link. And so we traced it back. Well, before they left New York, there was mold in the apartment. They had mold in their garage. They've had other toxin issues. Stressful life She was bottle fed her entire life, not breastfed. So she's already set up with a poor gut biome from the beginning. So we have all these factors predisposing her to having her gut as a weak link. And then a stressful event happens. Now the gut goes off. And so we always have to trace things back into a thorough history. But the moral of the
Yeah.
story being there's always a root, and diseases aren't random. Western medicine treats them like they are random. They are not. If we can
Mhm.
conclusively find those roots and remove them, give your body the tools and resources it needs, it will heal itself.
Okay. So let's say you've got a client and they weren't breastfed. They maybe their parents or their whatever, they didn't cook. So right from the get-go, they didn't have a great setup. And then they come in and they've got signs of IBD
Mhm.
and they come to see you. What do they do? Like, do you do any testing? Is testing necessary? Where do they go from there?
So we talked about how the gut's part of your immune system, and your gut will keep things at bay. If you have a very healthy, robust gut that was developed early on as a baby, you got the 3 days of breast milk colostrum, this big, thick turf, then a year, 2 years of breastfeeding after you had all these great probiotics and nutrients and immune factors and all kinds of stuff introduced to your body. You're going to have a very healthy, robust system able to fight off invaders. Those who do not are prone to things. And this is where we might see somebody if listeners have IBD or have had IBD, it's very common they've gone into the hospital and had antibiotic treatments done and come out with C. diff. And they go, oh, antibiotics cause C. diff. Well, C. diff or Clostridium difficile is a very pathogenic or very dangerous infection, and it can kill people. And the challenge is if you don't have that healthy, robust immune system inside of your gut through bacterium and other things, it can't fight off these what we'll call opportunistic bacteria, these pathogens, right? Somebody could be exposed to C. diff who's very robust and healthy and be perfectly fine. Their body will just get rid of it because your gut bacteria work like a community. They actually police each other and they compete for space. And so if you have a healthy gut, it will kick those out. If you do not, there's room for them to grow. They take the opportunity to sit and seed and grow and cause infection. And what do? Well, you hit them with more antibiotics, give them the vancomycin or give them the whatever antibiotics you decide to give to kill the C. diff. Well, in doing so, you've killed the other bacteria. This is where recurrent C. diff infections come in, and people have all these issues. On the other hand, taking antibiotics basically ever, unless it's an emergency like you're going to die, I don't advocate for them, and I won't for myself either. The challenge here, people go into their doctor, they're sick 3 times a year, give them antibiotics. I got a girl I'm seeing right now, 3.5 years. She was given over 3 years or 3.5 years, over 30 doses of antibiotics. So the doctors will recurring bladder infection. Let's just see what happens. Now she has ulcerative colitis and nobody can figure it out. It's
Mhm.
crazy to me. And so in looking at this, we have to understand there's more to the picture.
So
And
how do you test then, Josh? Like,
mm,
what do you do? Like, if they come to see you instead of going, let's say, I'm done. I'm not going to keep going on antibiotics. I need an option. I need other options.
yeah, sometimes we test with actual labs, sometimes we don't. Sometimes just a very thorough history. Testing can be 300 to 500 bucks a test, depends on what you're getting.
Yeah.
So I'll do hair, blood, urine, stool, whatever we need to get to draw. Obviously, blood I can't do myself. I'll have to get a kit requisitioned for you. You'll have to take it to a phlebotomist or a doctor, whoever, to do it for you. But we can test these things. So a very good one I've been actually using more and more is the OAT. That's the organic acid
Yeah.
test,
I've heard of
right?
that.
It's great. We get 76 different organic acids. These are byproducts. Bacteria, you eat, you poop. So do your bacteria. They eat and they poop. In all things, all cells, all toxins, these bacterium, they all produce these organic acids as byproducts. And so we can actually measure these in the urine to give us a really nice high level view of what's going on. We can detect some mycotoxins or mold. We can detect some fungus or yeast like Candida. We can detect bacterial overgrowths. We can see problems with neurotransmitters, immune system, kidneys. We can see all kinds of cool stuff inside of these, right down to like the cellular health. We can check hair, which isn't a super great tool, but it's a good tool for like heavy
I I
metals.
I've done some research on hair and Josh, like it's actually so it is not a detailed diagnostic
Super cool
test,
though.
but it's very cool because especially for like minerals and heavy metals, right?
Yeah. Oh,
Like,
I just got a heavy metals test back for a young boy with ulcerative colitis and autism. And guess what? He's full of heavy metals, which is neuroinflammatory. What is
yeah,
autism? A neuroinflammatory condition, right?
there you go. It connects.
It all connects. And so we can test what we need to test, but the idea is let's do a thorough history, figure out the most common probable root cause. Where do we believe this came from? If the symptoms line up, then if we want to confirm, yeah, we can go and get testing done. I've got a young man, he's 22 years old, and his doctor told him it's genetic. It's because you're Jewish, your family is Jewish, therefore you have this disease now. And he's like, what? I get ulcerative colitis because I'm Jewish. He goes, yeah, it's genetic. It's common in Jewish people. He's like, I thought that's a bullshit answer. So
Mm.
I sat down, Sandy, it took me less than 15 minutes. When did it start? We went back to the history. He started a new job in HVAC. 2 months in, got IBS, was diagnosed with it. 6 months after that, was diagnosed with ulcerative colitis. I said, okay, great. This new job, what kind of homes were you working in? Older homes? I said, great. Did you wear your PPE or personal protective equipment? No. I said, great. Based on your symptoms, based on the history, you probably got a mold infection. So what do? We did a
Uh,
urine test. He wanted to confirm. He did have a mold toxin called OTA or okra toxin A, very common mold infection. We ran him on a protocol. 10 weeks in, nothing.
okay, give me an example of a protocol for mold. I know that it's customized. So
Yes.
anybody who's listening, this is not for anyone, just anyone. Just I want to know like what happens in a protocol for say mold.
It does depend on the severity, and I have to be very careful. Before we dive into this, I will give the preface. If you are concerned about mold, please, please, please do not, under any circumstances, attempt to do it yourself. It can, in severe cases, be lethal. Trying to remove it improperly, you can create severe reactions. You can create a Herxheimer reaction where you can hypertoxify the body. It'll cause permanent kidney and liver damage if you're not careful. So you do need a professional to manage mold. That's my disclaimer. But what we
Hmm.
have to do is figure out one, what strains might you be dealing with? That's the big one. Number two, what damage has been done. So if your detox pathways, your lymphatics, your liver, your skin, your blood, all these things are all backed up with toxins, trying to detoxify a body is going to be a very bad time because now your glass is full. You're going to cause overflow and you're going to
Yes.
spill everywhere.
Yes.
So we do have to do a foundation phase, right? Prevent the insults, detoxify the body, get it prepared to start doing the cleanup work. Once that's happened and we have what we need, maybe it's supplementation for certain tools like vitamins, minerals on top of detoxifying, maybe it's sweating, maybe it's liver support, whatever it might be,
And drainage.
antioxidants,
Drainage is big
drainage.
too, because I say that to people. I'm like, don't go and buy a detox box off the
No.
shelf in a health food store because often it will you're just recirculating whatever it is that you're trying to
Yeah.
detox because you didn't do the proper drainage protocol in the first place.
And a lot of those detoxes are just diarrhea in a box. Like that's all they really do. And they make
Yeah,
you
it
think you're
just makes you
detoxing.
shit, people.
That's
Like,
it. It's
I
useless.
mean,
They're no
yeah,
good.
no, no.
No. So we have to lay the foundation. Then if we do a urine test to check for toxins and which ones, they're less than $400. We can see what specific mold toxins, and then we have to bind things. So there are specific binders that bind onto specific types of toxins, and we have to go very slowly, very slowly. Sometimes we throttle. We go day on, day off, or we very titrating the dose very slowly. But specific things, zeolite, charcoal, bentonite, chlorella, a fiber called glucosamine. There's even medications like Welchol. It's a uh, what's the word I'm looking for? It's a cholesterol medication, but it actually binds onto toxins in the bile, preventing recirculation. So we have all these really good benefits from certain binders, but using the wrong ones, the wrong dosing, wrong timing, wrong place, not setting the stage, and not knowing what you're doing can be extremely dangerous. But it can be done. And that's the
Mm.
thorn in the hand. Once you've pulled that thorn out, now we just have to rebalance things, clean the wound and let the body heal, give it what it needs,
Wow.
reprogram, retrain the immune system. It's not, it isn't complex, right? The more you do it, the simpler it gets. Um, but yeah, I see a fair bit of mold in my practice.
Yeah, I can imagine. That's a big issue. Now, one thing I do, because you talk about reversing,
Mhm.
that's a little bit of a controversial statement, right? Like, I'm
It
sure you've
is.
heard that because I've heard once you're diagnosed with an autoimmune disease, once you get that diagnosis, you can put it into remission, but you
Mhm.
cannot reverse it. I'm sure you've
Yes.
heard that exact statement.
Yeah. I vehemently disagree. I
Okay.
Yeah, absolutely. Here's the thing. Autoimmunity is a spectrum, and there are many cases that we've seen. I got a colleague of mine. I just brought him onto the team to work with me. He reversed and fixed, and no longer one of his clients no longer has signs of Hashimoto's thyroiditis. It's considered
Mm,
autoimmune. We're told autoimmune is autoimmune. But here's the thing, autoimmune is when the body is so on edge, right? Picture an autistic kid who's overstimulated. They start hitting themselves or hitting other people. They hit whatever's around them. Your immune system does the same. It's so overstimulated and so imbalanced that it starts to attack itself. Or we have a process called molecular mimicry, which we might see in autoimmune SIBO conditions, for example, or small intestinal bacterial overgrowth. And so if somebody gets like a food poisoning, they get this bacterial infection. Commonly, we'll see these bacterium actually mimic some of the enzymes produced by, say, the small intestine. And so every time you produce it, your body thinks, oh, that's that infection again, and it starts attacking yourself. It becomes autoimmune. But that's very, very rare. I would say probably 1 in 20 of the people we see in our program actually have an autoimmune condition where we can back it up, we get them better, remove everything from their system, and they still have problems. It's remarkable. And so again, even if you have a genetic predisposition and it's a genetic based autoimmunity, 25% of that whole circumstance is just genetic. The other 75% you can control through food and lifestyle and supplementation and toxic chemical exposure, through all these different things we talked about. So if we can manage that, then you're good. But even those who have
hmm
been diagnosed, I use the term reverse, and people go, you can't say cure. I'm not saying cure, I'm saying reverse, reversing the severity of that spectrum. If you're a 9,
Mm,
we can get you to a 1, maybe a 0. Maybe it is remission for life. Maybe you have these risk factors, but if you take care of yourself and you have no symptoms forever, and you don't go back to drinking beer and smoking cigarettes and all this garbage that caused the problem in the first place, and you don't have symptoms for 20 years, are you still in remission or is it cured? I'll leave that one up to you. And that's the argument I make. I'm not saying I'll cure you, but I'm saying we can reverse that spectrum, give you a quality of life. And then you can talk to your doctor and say, hey, let's come off these drugs. I don't need them anymore
yeah.
because they're suppressing a thorn that's no longer there.
Yeah. No, it's very good. Now, the before we close off, I do want to touch on constipation
Mhm,
because this is a very big concern for a lot of women, especially around menopause.
mhm.
And I know that hormones are involved in that. For somebody you had mentioned at the beginning, somebody who didn't go to the bathroom for like 2 weeks.
And 4 weeks, 2 and 4 weeks.
And
Yeah.
4 weeks. So how do you work with those clients?
The first thing we have to do is get them moving. And so in these instances, I am an advocate for integrative medicine, which means a combination of natural holistic protocols and pharmaceuticals, where you might use some heavy duty pharmaceuticals. Maybe you have to go and be disimpacted. Maybe you do need surgery to get this removed, and we can start working on it from there. Sometimes we'll use really high dose vitamin C, magnesium citrate, something to stimulate that process.
Yeah.
But there's so much inflammation, right? It's like, what do you do? The house is burning down and we're still pouring gasoline on the house. So let's stop the gasoline, number one. Number two, let's see if we can get in there and try to maybe remediate from the inside. But we can't build a house while it's on fire. And so I get asked it all the time, well, can I still eat these things or can I still do XYZ while you fix me? I say no, because that's the gasoline. And
Mhm.
so what do we do for these people? It really is all customized, but oftentimes it does take an integrative approach when it's that severe because a bowel movement every 4 weeks, and her doctor's like, well, it'll pass eventually. Like they genuinely
Mhm.
were not concerned. I was shocked. This person should be rushed to the ER because it is an emergency. They will tear, they will have a bowel surgery, and they will become very septic if they don't, and they could die. And so, constipation, my rule is this: if you're not having at least one easy, low to no strain bowel movement at least one time a day, you're constipated. Maybe low on the spectrum, but you're up there. Once every
Mhm.
4 weeks is severe, but
Yeah.
one bowel movement a day is the minimum, if not two or three.
Okay. Now, what do you think of, and I'm speaking of therapeutic grade supplementation. So let's say somebody's not really horribly bad, but they know that they've got some issues and they maybe bounce between constipation and diarrhea. What are your thoughts on formulations from high end? And I'm not talking about going to, your local drugstore or Costco just to get something that says gut. whatever.
Sure.
I'm talking about using, something that would be therapeutic, like a GI repair from NFH or, really good quality formulations. What are your thoughts on that for someone if it's not horrific?
Well, it depends. If it's not horrific and all you need is a little buffer, so your
Yeah.
body, because
A
your
little,
body only,
almost like a little tightening, a little like,
yeah,
let's do a little cleanup. It's kind of like, women who go and do dry January and they, you know what I'm saying?
sure,
Like a little gut
a
cleanup,
little
almost to be,
detox,
yeah, to be preventative of
sure.
anything worse coming down the road.
I'm all for those, provided, right? Again, we always have to ask, why did it break down in the first place? Because if
Yeah.
we are eating and drinking and sleeping and doing things like we should, you won't have those breakdowns anyway. It's like, why do people need chiropractors? Well, we sit constantly, we're in these slouch positions, our backs, like we don't use our butt hamstrings. So we need to go see a chiropractor, a physiotherapist. It's all breakdown from improper
Yeah.
use. And so sometimes all you need is a tune up, and that's great. But if you're trying to rebuild the house while it's burning down, you're chasing your tail and throwing good money after bad. You have to fix what started the fire. And so in those cases, I get people all the time, what's the supplement I can take? What's the thing I can take? What about, I
Yeah.
heard this herb is really good. I'm like, yeah, it can
Yes.
be, but it's a band-aid. And you're asking me to rebuild a house and you're giving me a hammer. It takes a whole
Hmm.
lot more than just that one thing. And so they can be very useful, but it's all contextual. It's like probiotics, they're all contextual. And I won't say one is good, one is bad. You mentioned women with hormones and menopause. Like if that's the primary cause, maybe HRT. Like who knows, right? Like estrogen is associated with smooth muscle function. And if you're
Hmm.
lacking that through menopause, you can have some issues. So there's always a root to it. And maybe they just need a little buffer till the body can repair and stabilize itself. But like I was saying, we have resources. We have a limited amount of soldiers to go and fix things. If you are inflamed, you're also not eating enough food and you're high stress and you're this and you're that. You don't have
Yes.
enough resources to build up. So yeah, try a supplement for now until you can calm things down and your body can then reach its homeostasis and rebalance and you'll be grand.
Yeah. Yeah. No, that's great advice. This has been such a great talk. Tell everyone where we can listen to your podcast. Where can we find you if we want to work with you?
Well, easiest way to find me, to find the podcast, to find everything is just through the website. That's gutsolution.ca. And we have a podcast called Reversible. That's Reverse Able, the ultimate gut health podcast. And it's all about the gut. It's about how the gut interacts with our world, how the world interacts with our gut. How do we keep it healthy? The disease connection of anxiety and depression and all kinds of diseases. I actually have an MS expert coming on in a couple weeks here to talk like all kinds of things and how they relate to the gut and what we can do about it. But all that can be found at gutsolution.ca.
Awesome. Thank you so much, Josh. It's just been such a pleasure chatting with you.
Likewise, thanks for having me on, Sandy.
Okay, I hit stop there.